Join me as I dive into the surprising differences between women's and men's heart attacks and see if I can spot the signs before it's too late. Heart attacks are often associated with men, but the reality is that women are just as likely to experience them. In fact, heart disease is the leading cause of death in women, responsible for 1 in every 4 female deaths. Yet, despite these alarming statistics, women's heart attacks are often misunderstood and misdiagnosed. Today, we're going to explore the crucial differences between women's and men's heart attacks, and why it's essential to acknowledge these distinctions for better health outcomes. We'll delve into the common misconceptions surrounding heart attacks, the unique symptoms women experience, and the physiological differences that make women's hearts more prone to certain conditions. By understanding these differences, we can empower women to take control of their heart health and ensure they receive the proper diagnosis and treatment. So, let's get started on this critical journey to uncover the truth about women's heart attacks. One thing is clear. Heart attacks are not a one-size-fits-all diagnosis, and it's time we start recognizing the distinct experiences of women. A common misconception about heart attacks is that they always involve dramatic, Hollywood-style symptoms like clutching your chest and collapsing to the ground. However, this isn't always the case, especially for women. In fact, research suggests that women are more likely to experience subtle symptoms that can be easily misdiagnosed or overlooked. For instance, women often report feeling unusually fatigued or experiencing shortness of breath in the days leading up to a heart attack. They may also experience pain or discomfort in their arms, back, neck, jaw, or stomach, which can be mistaken for other conditions like indigestion or a pulled muscle. Another misconception is that heart attacks only happen to older women. The truth is that heart disease can affect women of all ages, even those in their 20s and 30s. Furthermore, women are more likely to experience a silent heart attack, which occurs when there are no obvious symptoms. This means that many women may not even realize they've had a heart attack until weeks or even months later. The lack of awareness about these differences contributes to the staggering fact that women are more likely to die from a heart attack than men. It's crucial that we address these misconceptions and educate ourselves on the unique symptoms and experiences of women who have heart attacks. When it comes to heart attacks, women often experience different symptoms because of the way their bodies respond to stress and anxiety. For example, women are more likely to experience anxiety or depression after a heart attack, which can further complicate their recovery. Additionally, women's bodies tend to respond to stress by increasing blood flow to the heart, which can put extra pressure on the cardiovascular system. Hormonal fluctuations also play a role, particularly during menopause when estrogen levels drop. This decrease in estrogen can lead to changes in the blood vessels, making them more prone to damage. Furthermore, women's hearts are generally smaller than men's, which can make it more difficult to detect blockages and diagnose heart conditions. Social and cultural factors also come into play, as women are often socialized to put others' needs before their own and may delay seeking medical attention. This delay can have devastating consequences, as prompt medical treatment is essential for reducing the risk of fatalities and long-term damage. Studies have shown that women are more likely to receive delayed or inappropriate treatment, which can be attributed to the lack of awareness about women's heart attack symptoms. We need to recognize that women's hearts are not just smaller versions of men's hearts. They have distinct characteristics that require tailored medical approaches. In 2008, Debbie Olson was a busy working mom who began experiencing unusual symptoms: fatigue, shortness of breath, and pain in her arm. Despite her concerns, her doctor dismissed her symptoms, telling her she was just stressed and needed to relax. Hours later, Debbie suffered a massive heart attack that left her fighting for her life. The experience was a wake-up call for her, and she became an advocate for women's heart health awareness. Debbie's story is a powerful reminder of the importance of recognizing the unique symptoms and experiences of women who have heart attacks. Her story highlights the need for greater awareness and education among both patients and medical professionals. We need to empower women to be their own advocates and to seek medical attention when they notice something is off. We need to educate healthcare providers to take women's symptoms seriously and to provide tailored care that addresses their distinct needs. The differences between women's and men's heart attacks are real, and it's time we start taking them seriously. In conclusion, understanding the differences between women's and men's heart attacks is critical for better health outcomes. By acknowledging these distinctions, we can empower women to take control of their heart health and ensure they receive the proper diagnosis and treatment. It's time to recognize that women's hearts are not just smaller versions of men's hearts. They have unique characteristics that require tailored medical approaches. Leave a comment below sharing your thoughts on this topic or sharing your own personal experience with heart health. Thanks for watching. If you found this video helpful, please like, subscribe, and click on the bell for more health tips and updates.